And for the last few weeks, they've been very focused on launching these mobile testing sites. And this is not the traditional drive-through sites that we've seen. These are walk-through sites where we have also known as the phone booth-like test sites, where we can actually go where the vulnerable, untested populations are. And many of our immigrants and vulnerable populations, they don't have cars. Many of them are underinsured, unbanked, and they don't have access to testing. So I've been really pushing, as well as elected officials, to push this model forward. And today we're officially launching the Clean site. And I had a chance to we'll take a tour outside to look at it again with elected officials, but they've actually made it even more efficient and incorporated the booth inside the van. And it only takes 1 or 2 people to operate that van. And it literally takes, I've seen this in Brooklyn when they did a soft launch, about 3 to 5 minutes to come in, walk through, get a test, and 3 days later, you get the results.
People was asking me why we want to do this mobile system. And as you know, we have about 4 different type of systems running in New York City. First, if you have a patient, you get sick, what do? First thing is to go to ER, try to get help. Or they say, I call my PCP, I go to his office to see if he can treat me. Or they say, I want to test it, I go to a testing tent in the street corner. Or the fourth way is the drive-in system. All these systems in New York City have the fundamental problems. What is that? When we try to go to all the system, you go to ER, first, how you get there? You have to take subways, you take a bus, you even have a taxi, or a friend drive you down there. What happened? In all the way to go to the public transportation, you infect other people around, or other people in the system infect you, even you don't have a problem. And if you go to primary care doctor's office, what happened? You know, when you get in there, you have a disease, you may infect the people who sit in the waiting room for other diseases. You infect the staff, you infect the medical assistant, or maybe infect your doctors. The third system, by driving a car, hopefully reaching now in New York, drive a car, it's not very common. Number 4, you have a tent. You probably see a lot of tents on the street corner. All those tent systems, they don't have appointment. They go there and wait on the line. Most of my patients told me they wait for 3 hours. When you get down there, they ask a question, and they say, bye-bye, you don't need it. And they die next day.
You could go online directly at www.CAIPA.net/CAIPA/mobile-testing/.
Our PCP would screen the patients. After they screen the patient, they fit the eligibility criteria that is defined by the CDC guideline. Then what happens is they put in a referral through a lab that will well supported by BioReference. And once they fill in the demographic and name of patients, they submit that to our CAIPA SFAX, so it's secure, adhering to the HIPAA guidelines. And from there, our call center will call the patient to schedule an appointment, and whichever site that they fit. For example, if they live in Brooklyn, they should come to our Brooklyn site versus in Queens, right? Once they do that, we'll set the appointment up, and then the day of, they just come by, and all the instructions are in the vehicle listed there, or on our stationary site, everything's listed there. They show their ID to verify, and afterwards, we write their name on the test tube, do the swab, and then they go home. That's all. Very straightforward and simple.
Now, the ultimate goal is to scale this again. We have a proposal to get through 10,000 tests, and we want to go into communities that may not feel comfortable coming out of the shadows.